Okay, so my name's Haley, and this is my Level 2 Fieldwork Major Reflective Project over the big question that I had throughout my time at this first Level 1. So just to start, my site details. I was at Encompass Health Rehabilitation Hospital in San Antonio. It's an inpatient rehabilitation hospital. Common diagnoses seen, a lot of orthopedic, hip, and knee. That was kind of what I saw a lot at the very beginning, which was interesting since elective surgeries weren't supposed to be happening. There was a hospital that was kind of getting around it, I guess. Spinal cord surgery slash just spinal cord injury, strokes, amputees. I haven't had a lot of those, but a few. Brain injuries. I have had a few post-COVID patients, so just like the weakness that comes after that. Overall generalized weakness. I've had a lot of patients in for falls. Multiple sclerosis, I've had a few of those, and then Parkinson's. Age ranges, the youngest patient I had was a 32-year-old brain injury from a motor vehicle accident, and then all the way up until high 90s. So the details of Encompass Health that kind of led me to my question. Each patient must be seen a total of 3 hours a day. That's general inpatient rehab guidelines. So for this place, PT does an hour and a half, and then OT does an hour and a half, and speech is just like the extra buffer. So, if they miss a few days or if they had an appointment or something, they are only counted the 3 hours from PT/OT. So if they got speech or they're getting speech on other days, that can make up their time or help make up their time. So for physical therapy, you do 1 hour individual and then 30-minute group. If they're deemed ungroupable, some of our patients are, just for various reasons, then you would do an hour and a half individual time. That's also happened if we've had patients who are either pending a COVID test or came in with a positive COVID test. They're also, because of the COVID diagnosis, are deemed ungroupable, so they are an hour and a half in room. And then same goes for occupational therapy. We'll do 1 hour individual and then 30-minute group unless they're deemed ungroupable. So more about the occupational therapy group. Each therapist there has a blocked off time slot for a group session. OT does on the hour starting at 9, PT does on the half hour, and they're Monday through Friday. So any Saturday, Sunday therapy, it's just strictly individual. There's no group. And then it's the therapist's choice to choose the focus of the group session. So whether they do exercise, education, anything like that, it's the therapist's choice. It's not mandatory what you do. And then typically the group members in your group are your own patients. However, patients do get moved around, put into different groups based on timing, scheduling. Maybe they have something else that day, or they couldn't get into the group, things like that. Maybe they're better off in the morning, and so they put them in a morning group. That kind of happens. So it's kind of a mix of your patients and then others that maybe you don't know as well. So for the group details, the setup, there's a minimum of 2 people and then a max of 6. And from what I can tell, this was always a thing, but it also might just be because of COVID social distancing guidelines, just because of the sizes of the room. 6, I think, is what they've chosen to do to keep that 6 feet social distancing guideline. So the typical group types that I saw when I first started was a lot of upper extremity strengthening, so using a dowel rod, free weights, or TheraBand. And a lot of time with the free weights and the TheraBand, we'll also print out like home programs. That way, that's our way of getting the home program out to the patient. I have seen some endurance training also, so still using the dowel or free weights, but doing more of like quick up and down movements as fast as you can for a minute or so. So maybe not 15 and repetitions, 2 sets, but just more like endurance. My CI does some Tai Chi, not super often, but it's thrown in there a little bit. And then also pain management. This one's kind of rare. We only do it based on the patients we have. So if we think that they'd be receptive to it, do they even have pain? Are they cognitively there that they can even participate and know what's going on and benefit from it? So that kind of leads me to my burning question overall was, what creative group sessions can I implement at Encompass Health? And the reason I was brought to this question, so I have reasons for my patients and then also reasons for myself. So for my patients, I really think that the variety can keep the patient engaged and interested. Just personally, I think that upper extremity exercises every single day, the same ones, can get really old. And a lot of times patients will be like, oh, we're going there again. I just did exercises. So it is kind of a way to like bring some variety and help them see other things. Leading me to my next one, OT is more than just upper extremity exercise, and I think it's important to not only show the patients that, but just utilize that. Like, it's not just exercise. So I have here, what about leisure and fun? What about coping strategies? Also, what about peer support from others going through the same thing? That's something big. That is the reason why we do group therapy. It's one of the things that when I'm doing an eval, I check off when I say that a patient is groupable. So I really believe that sometimes talking and laughing with other patients is just what you need. And when you're doing more of the leisure things or education groups, it's more of a discussion, and so I think the patients are better able to get to know each other and talk with each other and see kind of where everyone else is at. Reasons for myself also, I just liked the idea of providing a variety of group sessions. I think it shows different skill sets for myself and other therapists. I think it's a decreased monotony and boredom just from doing the same thing Monday through Friday every day. And then I think it's an outlet for creativity, which is important in OT. So thoughts about my question. I really feel that changing up the focus of group sessions every once in a while is beneficial to the patient's therapy experience. Again, just showing them that there's other things out there, letting them know that you don't have to do upper extremity exercises, free weights, or delt every day. Like, there is variety and there is different things that we can work on to kind of, make the time seem faster. I feel like if you do the same thing over and over and over, it'll just drag. Also, I feel that finding creative ideas that are different and fun, yet still considered billable, will give patients a better idea of occupational therapy as a whole. And then I put here, we are not just ADLs and plain Jane upper extremity exercises. I think that obviously ADLs is a huge part of occupational therapy, but being taught that we have to really advocate for what occupational therapy is, I think it's important to also offer some other group sessions. I think that can add in some of the meaningful occupations for patients and things like that. If we're doing a group session that's more about leisure activity, maybe that brings in that meaningful aspect of occupational therapy a little more. So it just shows that we're more than the ADLs, but then it's also a way to advocate and really get the word out about occupational therapy and what we are. I also feel that having patients participate in group sessions that offer a more natural setting that promotes conversations with other patients is a good way for peer support and learning from others' experiences. Again, this is one of the big things about why we do group therapy, and so I think it's important to kind of facilitate that a little bit more. And then I also feel that finding ways to change the typical group session into something that is different but still able to be related to occupational therapy is a great way to get my creative juices flowing and grow as an occupational therapist. So, new group ideas. The types I've kind of come up with through my research: chair yoga, cognitive games, education topics, energy conservation, safety education, home environment modifications, seated kickboxing, leisure pursuits like coloring and drawing, and positive negative hands. Some things we've done, and then coping, so guided imagery and positive affirmations. These are from research, but also just from things that I've kind of seen and done in the past, things that I've seen maybe other therapists do, just kind of a melding of a bunch of different things that I've seen. Okay, back to it here. So I'll just kind of briefly go through these. So for chair yoga, the benefits: it reduces stress levels, it can reduce pain, it can decrease fatigue, it improves joint lubrication, improves balance, it's really good for arthritis, it can reduce anxiety, and it's a low impact form of exercise. So for the elderly or someone who has decreased activity tolerance or poor endurance, anything like that, this is a really good exercise to still get them, their heart beating, their body moving, but not super strenuous. And it's just really relaxing. So I have found different videos to follow off of YouTube that have been pretty good. Also, you can just kind of come up with your exercises, maybe have like a bank of them, kind of, I guess you could say, and based on the patients that I have, just kind of like choose from them and say, oh, well, maybe they can't do that one, or this one seems a little hard. If they're a little more higher functioning, I can give them the harder ones. So that's kind of nice to have. So cognitive games. Trying to get this out of here. Cognitive games, I think, is just really good. I know that there is kind of a line drawn almost between speech therapy and occupational therapy and like who takes cognition. But I really think that it should just be both, even PT. I think that cognition is a really huge part of therapy, regardless of what therapy it is. Although I think that OT and speech do a little more, I think it's important. So we've done a few of these. We've done this a lot with categories with the alphabet. So we'll go A to Z, and I usually stand in the middle with a balloon, and I hit it to each patient, and every time the balloon is tossed to the patient, they hit it to me back, and whatever letter we're on, they'll say something from the category. So it's not only working on cognition, but also working on range of motion, coordination, things like that. So we've done animals, foods, cities. I think we've done a few more, but I can't remember, but they've been pretty fun. I think animals has been the most popular, although I like food, so I always try to get that one to be the category. We've also done a cognitive game, which can also be considered leisure, but beanbag toss with a math component. Usually when we do the alphabet game with the balloon, we do this one at the end, so it's kind of combining. So we will do beanbag toss, and if they're able to stand, with supervision, I'll get them to stand just to kind of make it a little harder. But I give them like 5 or 6 beanbags, and they will toss them onto the board that's labeled with different, so there's tape, and it's like 5 points, and then 10 points, and then 15, and then in the hole is 20. And so as they're tossing them, everyone will add up in the group. So it's in your head, it's not a calculator, so you're having to really think about what they got, maybe do some multiplying if they got 2 in one place, something like that. So it's been really fun. The patients seem to really enjoy it. There's a lot of laughing, there's a lot of banter between each patient, and so it's been really nice to see. Education. I haven't done a whole lot of the education groups. I've taken the research I've found and really mainly just used it individually, but it is a possibility to do it as a group session. So the first one is energy conservation. So 4 P's of EC: planning, pacing, prioritizing, and positioning. This was a good little PDF I found. I know it says energy after a concussion, but it's essentially the same things. So prioritize the most important things during your day to help save your energy. Plan out your day and break up your day for planning and pacing. And then positioning, we'd like to tell our patients a lot if we're cooking, sit when you're prepping, or sit when you're folding laundry, things like that. Sit when you're taking a shower. So just ways to position your body so that you are expending less energy and not getting as fatigued. Another education topic we could talk about is safety. So falling under this category, fall precautions. Those are just, pretty general. Wheelchair safety, functional sit to stands. So teaching them to lock their brakes, scoot to the edge to stand. When they're backing up to sit, back up until their knees hit the chair, pushing off the armrest, reaching back for the armrest. All of those safety things that just, if someone's going to be in a wheelchair or while they're in a wheelchair at rehab facility, they should learn how to be safe and utilize it in an appropriate manner. Also, we do a lot of bathroom equipment as occupational therapists. So shower chair or tub bench, really just seeing what the patients have, what their bathroom setup is, and then going from there. Also grab bars, and then seeing if we need to